The protein that is normally made for this gene is known as FMRP protein. It helps regulate brain function and cognitive development. When the mutation occurs, it completely turns off the protein that is usually made. Diagnosis usually occurs somewhere between 35 to 37 months of age, or 3 years, and it usually occurs when the parents notice their child isn't developing normally, either physically or mentally. Once it is determined that the child isn't developing at a normal rate, the usual test given for Fragile X syndrome is the FMR1 DNA test. There are several different treatments that can help manage Fragile X syndrome. These include speech therapy, ADD medication, physical therapy, and special education. Clinical trials are currently underway for a compound that should dampen the mGLUR pathways. There is a theory that too much mGLUR/LTD causes autism and the developmental disabilities associated with Fragile X syndrome. Even though both sexes can be carriers for the disease, female carriers have been known to have the number of repeats in the promoter part of the gene increase as the gene is passed on to future generations, making it unstable. In some cases, carriers of the disease have been known to show social and intellectual traits that could potentially mark them as carriers of Fragile X syndrome. These include social communication difficulties, ADHD, anxiety, and depression.